I'm in Syria, sprinting across my grandma's porch, desperately chasing moths. It's late at night, and my older cousin Yusuf and I are competing to see who can catch more moths in our jars. Yusuf yells from the other side of the porch, "Shift kaman wahde! I caught another one!" My eyebrows furrow as I try to come up with strategies to finally catch more moths than Yusuf. I'm fixated on my own solutions, thinking, maybe I'll catch more if I wear darker clothes so the moths won't see me coming. I was living in Jordan at the time, but every other weekend, we would drive to Damascus, Syria, and go to my grandma's house, where I'd see Yusuf and his family. I spent every dinner planning my next strategy for how I'd finally beat him in our nightly competition. But no matter how hard I tried, Yusuf would catch triple as many moths as I did. But I remember this one evening, after dinner, when I saw Yusuf slip something into his pocket before walking out onto the porch. I peeked my head out and saw that his jar was lit up by a lighter. I went back in and rummaged through my grandma's drawers until I found the lighter that I could use, and I carefully placed it into my jar. That night, with a bright yellow flame lighting up my jar, I still didn't catch as many moths as Yusuf. And maybe it was because he was older than me or more experienced, but over time, I caught more and more, and eventually did successfully catch more moths than my older cousin. Looking back, I wondered, why had it taken me so long to notice his strategy? I was so focused on my own methods that I hadn't actually looked over at Yusuf and seen what he was doing to be successful. That same house we were catching moths at was later bombed at the start of the Syrian civil war, and Yusuf became a refugee. As I got older, I became really interested in refugee healthcare, an intensely complex problem. And I began to realize that when most people approach problem solving, they're fixated on finding their own solutions. So what I'm going to talk about today is this simple idea of learning from other people's solutions, called positive deviance. Positive deviance is this phenomenon where you look at different people that have access to the same resources and are struggling with the same problem, and you find the person that is more successful than the others. This uniquely successful person is called the positive deviant. And finding the positive deviant gives us a chance to learn from them and ask, what are they doing differently to be successful? Monique Sternin, a positive deviance researcher, has directly shown that finding the positive deviant is effective when you don't have access to a lot of resources. Sternin was in a small village in Vietnam where almost 70% of the children were malnourished, many of them at risk of dying. So Sternin looked for the positive deviance. Her and her team were looking among the poorest families for the children who were healthy, despite having the same access to resources as the malnourished children. After gathering information and data on all the families of the healthy children versus the malnourished children, she found some clear differences. Healthy children would eat tiny shrimp and crab from the river mixed with sweet potato leaves, highly nutritious foods that were easy to access in the village. The behaviors they found in healthy children were simple and easy to apply to the malnourished children. Because positive deviance uses locally resourced solutions with no need to come in from the top down and input new resources. Using the solutions they found from the healthy children, Sternin and her team were able to reduce child malnutrition in the village by 74%. I was so impressed by how something as simple as observing others and learning from them could save lives. I saw a lot of studies like Stanford's that applied positive deviance in low-resource settings. But I noticed these studies were being done on an individual level, meaning through person-to-person comparisons, like healthy child to malnourished child. I wondered if positive deviance could be applied on a system level, specifically on a refugee healthcare system level. Positive deviance gives us a new way to go about problem solving. There's this global system-level problem of refugee camps being overcrowded and not having enough healthcare resources. You could approach this problem by adding more resources. But it's difficult to sustain continuously adding more resources to every refugee camp. So instead, I wondered if we could have different camps learn from each other and learn from each other's successes through positive deviance. And in that way, learn to better use the resources that are already available to them. My main question became, can we use positive deviance to improve refugee healthcare? I found that to be able to use positive deviance in refugee healthcare, we would need to complete 3 steps. 1, find the positive deviant, the refugee camp who is uniquely successful, even though they have similar resources as other struggling refugee camps. 2, find what the positive deviant is doing right by looking into factors like how their healthcare staff behave or how they use their resources. And 3, apply what we've learned from the positive deviant to model the same success in other refugee camps in that country or even refugee camps across countries. Comparing refugee camps would be a form of system-to-system level positive deviance. So I looked for examples of positive deviance working on system levels. I found that most of the newborn intensive care units in California are part of a big quality improvement program. The program is a collaboration across California's neonatal units where each hospital agrees on collecting healthcare data and making all of this data public and easily accessible. Different hospitals then present at large conferences where they share what they've been doing well and what they've been struggling with. Then, the neonatal units struggling with one aspect of care adopt practices and behaviors from the units who have been successful in that aspect. They measure success in terms of factors like mortality rates and infection rates. And so far, their collaboration has led to a 21% decrease in mortality rates for low birth weight infants and a 49% decrease in healthcare infections overall. These hospitals in California were able to apply system-to-system level positive deviance from one newborn care unit to another to save lives on a large scale. But unlike refugee camps, these hospitals are considered high-resource settings. Examples like Stern's malnutrition work show us that positive deviance can be used in low-resource settings. But that's on an individual level. Examples like California's neonatal units show us that positive deviance can be used on a system level, but that's in high-resource settings. Refugee camps are a combination of both these examples. Applying positive deviance to refugee healthcare would be system level in low-resource settings. And I wasn't seeing examples of positive deviance being used on system level in low-resource settings. That took me back to the question of, can we use positive deviance to improve refugee healthcare? And the answer I found was no, not yet. And let me tell you why right now we can't use positive deviance between places like refugee camps that are system-level, low-resource settings. The key here is information sharing. That California newborn care collaboration requires the data about each intensive care unit to be collected and easy to access. By being held accountable to share their successes and their failures, each hospital is able to learn from each other. Positive deviance is just a form of learning from each other's information. But you can't learn and share information if you don't have the information. For step one of finding the successful case, the positive deviant, you need data, like who has the lowest mortality rate. For step two of finding why that camp has been successful, you need information, like how doctors behave or how they're using their resources. Without this data and information, you can't ever get to step three of applying what you've learned from other successes. And so you can't use positive deviance to improve refugee healthcare. What we are missing here is information. For refugee camps to learn from each other, we need to start collecting accurate and organized healthcare data and make that data easily accessible so we know who is successful in each aspect and so we can learn from them. Overall, the importance of positive deviance is highly overlooked. This idea of looking at someone else if they're doing something well seems obvious, but nowadays, it's a radical idea. With the shift in society today towards the Silicon Valley, do-it-yourself startup attitude, we forget that solutions don't have to be complicated and original, and there's no shame in modeling your success based on others. You need to be transparent about your failures and share what you've learned from your successes. And you also need to let yourself seek out others who have been successful and learn from them. Instead of putting all your efforts in finding some new innovative way to find a solution that may already exist, remember the importance of collaborating. And don't be afraid to look to others for help. This can be as large scale as refugee healthcare or as small scale as catching moths in a jar. But ultimately, we all have something to learn from each other. Thank you.